Our next question is from Joe Ingles with Ohio Public Radio and Television.
Thank you, doctors, for doing this. I want to ask about these numbers that are on the website, on the dashboard. ODH has to continually, there's been spurts, different times during this pandemic where you've had a backlog of numbers and they haven't been put in right away. And it makes it very hard to determine immediately what is happening. It kind of skews the whole process. Why is ODH continually having problems getting these numbers in there correctly?
Yeah, thank you for that question. So the answer is, as we have gone through this pandemic, throughout the pandemic, we have hit numbers of cases that have absolutely exceeded anything that anyone had really, I think, ever encountered before or possibly even imagined. So most recently, what we encountered, and by the way, other states encountered this as well, if you look at the national CDC reporting that's publicly posted, is numbers that were actually in excess of what our electronic systems could process, whether at the state level or even from the reporting level from some testing sites from across the state. So what we did was work very aggressively to augment those systems and to do some rapid, both human and technological efforts to expand their capabilities in new ways. And those were deployed very rapidly and allowed us to catch up very quickly, really within the span of about a week. But the thing to bear in mind is the only numbers that were affected were the total case counts. Certainly the case counts for each day when they were finalized were accurate for that day. But the total case counts that we offered essentially were above 20,000 cases per day. Once we're at that level, especially recognizing that there are cases that, and we've talked about this, that weren't even reported into the system. Once you're above 20,000 cases a day, we're at a level where the transmission is just ubiquitous. The transmission of the virus is happening at an unprecedented level. And that's really all we need to know at that point from a medical or an epidemiologic point of view. So while it's nice from a collecting the facts and looking in the rearview mirror to know the exact number, frankly, it was not something that really had any impact whatsoever on our ability to understand what was happening or what responses needed to occur. When you're at astronomical levels of spread, you're at astronomical levels of spread. And a few thousand cases are not going to change that calculus. Throughout, however, the most important numbers like the number of people who were being admitted to our hospitals, to our ICUs, being on ventilators, those numbers have remained accurate and up to date, and that's really required extraordinary effort, both on the part of our hospital partners and our state data collecting system. So I'm not sure I would agree with your characterization.